Alright, good morning again, everyone. Good morning, Doctor. Alright then. First things first, let's just get the whole let's just get the whole Dr. MJ thing out of the way. I am MJ. Alright? We're here at Food for the Poor Band Camp. And as many of you may know, I'm a past member and this is family. So everybody here know me as MJ. Alright? So we're just MJ. Everything good? Alright, MJ is good. Cool? Alright, so first and foremost, we got through devotion already, right?
Yes, sir.
Yes, so my apologies for being late. Alright? As we know, today we're going to have an oral health talk. And I'm hoping that it's going to be an interactive one. We ask questions, we share our experience. This is a space, safe space to talk about our oral health. Cool? Yes, sir. Right? Sounds like a plan? Yes, sir. Yeah, man. It is a privilege and an honor to be back here with the team. And I just want to take a moment to encourage before we start. I see some familiar faces and I see some new faces. And I remember just being in your shoes at your age or probably younger, going through the camp, not knowing where life would have taken me. But this camp was one of the pivoting experience and influential moments in my life to help me to be who I am today. And I just want to encourage a young lady, encourage a young man that take the lessons that you can take from this camp, implement it in your life, put it to action. It's not just about playing music, but it's the discipline that comes with it. It's the different life lessons that come with it. This is an opportunity that many others don't have out there. So don't take it for granted. Amen? 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 Amen. All right, that sounds like a plan. So, MJ stands for Marlon Jr. So Marlon Jr. Williams is my full name. All right, and today we're going to have a conversation about good oral health. All right, before we go any further, who can tell me what good oral health is?
Brush your teeth every day.
Brush your teeth every day. No, man, if you put the hand up, I take it down and then tell me no, you know. If you put the hand up, go my bro. As a matter of fact, I would like to learn the name. So if you can tell me a name before, that would be nice. So, remember I need your name again? Samuel. And Samuel said brush every day. Go again? Navi. Alright, Navi. Go again? Brush your teeth every day. Proper hygiene. Sammy, you want to go again? Brush in your teeth. Derek, taking care of your smile. Mouthwash, and what is your name? We never get your name. Go again? Jaden. Alright, so we told them we're getting some positive answers. And before we even go any further, just want to acknowledge and dig up Jeffrey Brown and all the instructions that you are seeing here would have been my cohort and my brethren, yeah, when I was here. So much respect to the gentlemen in white and red. I want to pick up my wife around the back there. None of this would be possible without wife. You understand? Let's backtrack a little bit and let us have a general understanding of what the mouth is, right? Before we can go into listening, before we can go into the different instructions with a good oral health. For the mouth, each person has two sets of teeth in their lifetime. And we know that they are the temporary teeth and the permanent teeth. Everybody following? What are they there? Temporary teeth. And the permanent. Nice. Next. Now let's talk a little bit about the temporary teeth. Now, there are other names for temporary teeth that many of us may know them as baby teeth, middle teeth, primary teeth, and what's that last one? Who can pronounce? Not delicious. Insidious. What is it called? Deciduous teeth. So there are 4 other names for temporary teeth: baby teeth, middle teeth, primary teeth, and not delicious. Deciduous teeth. Alright, now, our baby teeth erupt in our mouth. When we say erupt, they start to push through the gum in our mouth at age of 6 months. Let me see the hands of all those who can remember when their baby teeth came out. I'm not too light. Put them in the hand. No man. You ever come out late and you remember what age? When you can't remember that. At 6 months, when you are a baby, your baby teeth start to erupt in the mouth. And at what age would you start seeing the permanent? 5, 2, 8, 13, no. No. 18, 1, no. No. And let me pause for a moment because my little friend around here, his sister is one of my classmates in dental school. So I'm gonna put you on the spot, bro. What age does your permanent teeth start to erupt? No, not 14. At age 6 years old. Everybody say every number except 6 years old. 6 years old. So your baby teeth at what age? 6 months. And your permanent teeth at 6 years. Cool. Let's continue. So the baby teeth, they tend to be what? White and pretty. This is how the baby teeth look. They look really white. Really white. Yeah, man, and sometimes they're small, sometimes they may be big, but the baby teeth are really white and they are pretty. However, when we go over into our permanent teeth, right, it may be a little bit yellow, but the permanent teeth start to come up at what age? 6 what? Years old. Some persons may experience their permanent teeth coming out a little bit earlier, for those who mature faster, and some persons may start a little bit later, but it's in the general age of 6 years old. Alright? Now, while the baby teeth may be really white, the permanent teeth at times can have a little yellow hue. Now, I used to come to this camp. I know what this is like when we give each other a nickname. We're literally talking about it just a while ago. We do the worst thing when they come on to giving each other a nickname. But don't discourage your friends, your family when you see their teeth a little bit yellow. It just may be the natural color of their teeth. Now, many times we will want to get teeth whitening. When we see the answer all those who want to get teeth whitening, I know. Everybody wants teeth whitening. And if I should ask you when last 15 minutes, everybody hand go low. We can't get whitening before our teeth clean. Right? So don't be discouraged if you're seeing a little bit of a yellow looking shade on your teeth. That's just the natural shade of your permanent tooth. Cool? Now, the important thing to note with permanent teeth, can keep rolling, is that when you lose a permanent tooth, unlike the baby tooth, it won't grow back. Let me see the hands of all those who lose a permanent tooth already. Don't point for nobody. Right? And when you lose that permanent tooth, you won't be getting back any other tooth in that space. This why? That's a very valid question. Everybody listening? The question is why? Now, number one, the way we can institute that is that the baby teeth, and mark you, almost every other species there are recently becoming a dog owner. I'm appreciating this. Almost every other species that God created go through the similar thing, where they have a baby teeth to carry them through a period of life as they are babies, but they transition into a permanent set of adult teeth, which will last them for a lifetime. And if you don't take care of it, then you're going to lose your teeth early. And then we're going to have what Jamaicans like to call mash mouth. Now, what know what mash mouth done? Right. And let us pause here for a moment and let us bring it a little bit home to something that we can relate with. As musicians, as instrumentalists, we need to take care of our oral health. Let me see the hands of all those who play wind instruments. Right. And we're going to be taking up our instruments, and we're going to be playing our instruments, and we're going to be blowing bacteria into our instruments. Right? We're going to be transmitting bacteria into our instrument, and then we'll put it down and we don't take care of our oral health. and we don't take care of our instrument, we take up the instrument and put it right back in our mouth. That in itself is nasty.
Very nasty.
Right. I mean, I thought like me never do them things there too. Because when we start off, we never know how to do it. I mean, there wasn't an oral health presentation in my time, but so that we learn, we are now here to share and impart the knowledge. Right? Right here on stage, I have one of Jamaica's well-renowned instrumentalists. Of course, with his profession, he must take them things serious as well. You understand? Right now, you guys are in the early stage of becoming one of Jamaica's best musicians and instrumentalists out here, but you have to adapt the correct oral hygiene and the hygiene as a young man and a young woman to present yourself with confidence. You understand what I mean? And this is why it's important. So let's talk a little bit about, next slide, let's talk a little bit about the different type of teeth. And everybody should know this in school. What are the different types of teeth? And where the incisors are located? At the front, right? What else do we have? Canine. And where the canine? At the side. What we call it? The eye teeth. Many Jamaicans we don't call it the eye teeth, or what they call it, the vampire teeth. The teeth at the side. What do we have next? Premolars. Those are the little ones right before the molars, right? And the last one that we have are? Molars. Nice. Let's just pause for a moment. Hold on 1 second. You got any more people, please? Can you come 1 second? Right, so like we just talked about different type of teeth. Let's talk a little bit about the molars. Now, when we have our permanent molars coming up, let's say at age 8, 9, 10, right? There's a set of molars that we know are called the wisdom teeth. Who can tell me at what age the wisdom teeth come up? 30? 30? Thank you, I like this answer. What's the answer? 17 to 25. In your young man, what's your name, girl? Kyra. And what do you want to be when you grow up, Kyra? Kyra wants to be a pediatrician. I love that, Kyra. Alright? So Kyra says at age 17 to 25, we will start seeing the wisdom teeth coming out. Now, it's very important to note, guys, everybody listening to me, with our ethnicity, what ethnicity means, with our race, as black people, it is known that we don't have enough space for our wisdom teeth when we reach that age. So many times you have to go to the dentist to get our wisdom teeth removed or treated. So many of us here, or many of you here, are slowly but surely approaching that age of 17 to young adult stage. So I wanted to take the moment to encourage you. Tell mommy and daddy, at a certain age, you want to go to the dentist to get my wisdom tooth checked. All right? Question? Why? Why what? Why we have to check it out? As I said to you before, with our race, at times the wisdom teeth doesn't have enough space. So what happens is that it will grow into the tooth beside it. It can cause damage. It can be growing other places inside our mouth. We have cases where the tooth is all the way down in the bone, laying down flat. You have to do surgery to remove those things. You understand? It's very important to find these things out from early. All right? That is a side note that we're sticking inside here. Everybody understand? Next. So given that we have an understanding that we need to take care of our permanent teeth. Why we need to take care of permanent teeth? See if everybody listen. Because once we lose them, they won't grow back. So given that we have an understanding that we need to take care of our oral health, let's talk about what a good oral hygiene is. So good oral hygiene is really and truly steps that we practice every day to ensure that we have a healthy mouth. that sounds similar to us as a musician. Every day, instead of doing everything else and playing games, if we want to get better at our craft, we need to do what? Practice. We need to practice. If I'm not mistaken, he said as a professional musician, the professional musician, not a professional musician. We need to practice at least 8 hours a day. That's all. So them say. Right? That's how I go, okay, right? So we need to ensure that every day, if we want to achieve a good oral health, we need to practice the necessary steps every day. You understand what I mean? Let's move on. So the first things first, everybody know what's the one thing that we can do to take care of our oral health? Brush our teeth. Let me see the hands of all those who brush their teeth. Every day. 2 times daily. At least in the night. Let me see the hands of all those who go like a couple days without brushing their teeth. We're in the chapel, you know. We're in the chapel. We like the honesty. Right. Right. So brushing your teeth and your tongue twice a day with a fluoride toothpaste is what is important. Now let's take note of something. Fluoride. Many times it's asked, which toothpaste should I use? There's nothing wrong with using a different brand of toothpaste. What is important is that it is a fluoride toothpaste. Why do we need fluoride in our toothpaste?
White teeth.
White teeth, no? It's a very important question, but I want to answer the question I asked first before I explain.
Take off bacteria off your teeth.
Take off bacteria in teeth is getting really close, warmer.
Sir,
It makes your teeth stronger. That sounds like the answer. But if somebody wants to give it a different way though, you go to do what? Take off the grime off your teeth. That sounds like it can work. You want to give it a try, Aaron? Clean your teeth. Strengthen your teeth. Yeah, I like that answer. No, everybody's going to give it a try? It makes your enamel stronger. We're getting warmer and warmer. Those answers are correct. Helps to clean your teeth. I'll give it in this way. Fluoride, guys listening? Fluoride remineralizes your tooth. What it does?
Remineralize.
Thank you. What happens when decay develops in our tooth and we have cavity is because we go through demineralization. Demineralization causes cavities. Remineralization protects our. Thank you. Right? And the ingredient that is important for remineralization is fluoride. That's all we need to know. That's what is important when it comes on to brushing your teeth. Another thing that is important is the correct technique. Let me see the hands of those who know to correctly brush their teeth. In one sentence, how should we correctly brush our teeth? Hold on, I want to hear from this lovely young lady at the front. Up and down, no, close enough. Circular motion, thank you. So we brush our teeth in what? Circular motion. When we scrub it back and forth like we're washing our clothes, what are we doing? We're damaging our teeth. We're not washing clothes on Saturday morning and our white clothes we are washing. We are brushing our teeth. So we brush our teeth in circular motions, and that protects our teeth. That protects our gums. And what kind of toothbrush should we use? No, not soft brittle toothbrush. No, we should not use tough toothbrush. What happens if we use a tough toothbrush and scrub our teeth too hard? Destroy your gums, that's one. Causes what? Bumps? No, but close. Destroy your enamel, and when you destroy your enamel, what happens? Teeth become weak, and then what happens? No, what will you feel in return? Pain. What kind of pain? Sensitivity. So when you drink something cold, when cold breeze past your teeth, you take up an instrument to play your instrument, And you feel sensitivity because what? We're brushing our teeth too hard and we're using a hard bristle toothbrush. Alright? So how long should we brush our teeth? 2 to 3 minutes, not 30 minutes. Not 1 minute, not 30 seconds, because many of us when our parents tell us to go to the bathroom, we go to one time. I will spit out and we'll come back and think that we do self-justice. You understand? So we need to give it 2 to 3 minutes, right? So the first thing in the morning, what do we do? No, the first thing in the morning we pray. What we do? And what's the last thing we do the night before going to bed? Pray. Thank you very much. And what we do before praying? Brush your teeth. That's all I got planned. Next one. We cannot go to God with a stinking mouth. Alright, next one. Alright, so let's watch this quick video. I want you guys to pay attention. Remember, we said the important thing about brushing is the correct technique. Because whilst demineralization will happen and we get cavities, if we brush our teeth too hard and we brush it wrongfully, we can lose our teeth as well. We are listening. So I want you guys to be attentive to the video. Pay attention to the video. And we're going to have a discussion about the video afterwards. Cool? Yeah. Alright, let's go.
Brushing your teeth is an essential part of your daily dental care routine, and when done properly, leads to a healthy mouth and smile. Proper brushing should take at least 2 minutes and be done twice a day. Using a soft bristled brush and a fluoride toothpaste are recommended for removing plaque from your teeth. To follow the correct brushing technique, start by tilting the brush at a 45-degree angle against the gum line. Using short, back and forth strokes, gently brush the outer, inner, and chewing surfaces of the teeth. When cleaning the inside surfaces of your front teeth, make sure to tilt the brush vertically and move your toothbrush in up and down strokes. Finally, make sure to gently brush your tongue to remove bacteria and help freshen your breath. Remember to replace your toothbrush when it begins to show wear, or every 3 to 4 months. You should also change your toothbrush after you have had an illness. Keeping a regular toothbrushing routine and using proper brushing technique is one of the most important things you can do to keep your teeth free of bacteria and reduce the likelihood of tooth decay.
All right. Let's talk about the video really quick. And then we'll do the next slide. So first thing first.
Sometimes teeth can develop cracks, and when not treated, this can have serious consequences for your oral health.
All right. So let's have a quick discussion about the video. Right? So we already established that we need to use a soft toothbrush. And we said circular motion. And the video showed us the different techniques and the areas at which we should position the toothbrush. But there's an important thing that it says. We should position our toothbrush at what kind of angle? 45 degrees. Right. And that's really and truly just to protect the gums. When we have the toothbrush rubbing against the gum, we said this already earlier. What's going to happen? We're going to have swell up and we're going to have sensitivity and we're going to have bleeding gums. When we take the toothbrush, we protect our gums and we brush our teeth. Cool? There's another important thing. How often should we change our toothbrush? 3 to 4 months. Let me ask you a question. How often do we change our toothbrush? Once a year? Once every 3 years? When it gets very soft? 3 months? Once what? Once every 20 days. That's very specific. When you feel like it, but like honestly, once every 6 months he changes toothbrush. Every single day you change your toothbrush. Every 7 days, every week. You change your toothbrush every week. We don't have so much money to buy a toothbruch every week. I mean, I want to end this. When it's frizzle up. Okay, I hear you. But how often should we change it? 3 to 4 months. And that is very important. Why should we change our toothbrush?
Because
the bacteria builds up in the toothbrush. Let me ask you a question. That makes sense, right? When the bacteria builds up in the toothbrush, We are basically at this point putting back the bacteria on our teeth. When we are bathing and we have a dirty rag, do we use the dirty rag to bathe with? No. Right, we throw away the dirty rag. Right? If we are using a washing brush and it's very dirty, you bathe with the dirty rag? Oh. Okay, right? When you have a dirty washing brush, you use the dirty washing brush to wash your white clothes them? No, okay, we mess up the dirty white clothes. Wash it out first, but at some point we will mess up the white clothes. You wanted to say something?
While using the toothbrush and start brushing out, you will start taking off less and less grime until it's not doing anything.
That's a very valid point. Very valid point. What he's saying is that the toothbrush will lose its effect. It won't make any sense to keep using a brush. When you're washing the dishes and your Scotch Brite or whatever you use, it starts frizzle out. You don't use it again because what? It's damaged. And another valid point is that we should change our toothbrush whenever what? When you're ill. Let me see the hands of all those who change the toothbrush when they get a flu. I don't do it. I mean, I do it now, but I didn't do it before. I never understand it. You understand? But imagine you are sick, you have the bacteria, the coughing, the sneezing, the cold, and when you get better, we have the same toothbrush rubbing around that bacteria inside our mouth, sometimes even swallow it. You understand? We need to change our toothbrush. That sounds like a plan? So every 3 months for the year, how many times that is? 4? Sure? Pep students? Sure? Okay, that's what I got plan. 4 times. That is correct. That is correct. Alright? Alright, next. Another thing that we can do, so we spoke about brushing our teeth. We listening? Listening? Hey, we're not looking back in my days when we now listen to Jeffrey, you know, we just want to stick up and sail right through the crowd. And I wonder where the sticker come from. Anyways, it is so we spoke about brushing our teeth. We spoke about the toothbrush, and now we're going to be speaking about rinsing out. After brushing our teeth, we should rinse out our mouth. And throughout the day after meals, we can rinse out our mouth. Let me see the hands of all those who rinse out their mouth after meals. Not every day, right? I don't mean every day. Because we think that we need to have a mouth rinse to do that. But it's as simple as water. We can use water. God give us water. Water is such a beautiful component. If you really break down the science behind it, you know those miraculous things that God ever gave it. You can just use the water, rinse out your mouth, and just spit it out. You have a question?
No, sir, so just to listen. What is that way of talking for them? So what if we don't want for reason?
What if I do what?
Don't want the food to come.
You want to stay by the taste?
But it doesn't need a 5-star meal, sir. It tastes good, sir.
Well, if you want to continue the taste, then I think you should just have to buy another meal. But as it relates to savoring the taste, the whole thing that you're savoring really and truly is the bacteria on your teeth. Alright? So rinsing out the mouth is a wise thing to do. I'll pause here to say this. Sometimes it's not wise to brush your teeth immediately after eating. Alright? It's not wise to brush your teeth immediately after eating. Sometimes the mechanical components of brushing your teeth and the chemicals in the toothpaste mixing with the food can damage your teeth. So you wait until the natural bacteria in our mouth break down the food a little bit, so it's easier for us to brush and remove all of that buildup. Make sense? Next slide. Another thing that we can do is take care of our oral health is to floss. Why do we floss? Thank you very much. That's the answer I'm looking for. The brush cannot reach in between our teeth. I don't know why it is that it's so hard for us to appreciate this, even myself, but we need to clean in between our teeth. And the bristles of the toothbrush cannot get in between the teeth. So what do we use? Floss. No, I don't have it in this slide, but it's very important that we know how to properly floss. I should have at least put a video, but let me see if I can explain it for you. When we use a floss, right? Well, if I want to go in details, I personally like to wrap the floss around my middle fingers, probably do it 1 and 2 times on one finger, and do it multiple times on one other finger. Why? As I floss, I put the dirty side to one side and unravel a clean side. That makes sense a while ago?
Yes.
Alright? So, dirty side and clean side. So as I floss, wind up the dirty side and unravel the clean side. Nice. I use my index fingers and my thumbs to hold the floss. We then hug the tool. What do we do? Hug the tool. So we're putting the floss in between our teeth. We don't just jam it in there and damage our gums. What do? We hug the tool. And then we go in and out. That way we don't damage our gums. Personally, there's nothing wrong with using these type of floss, the pick type, but my issue is that whenever we use it, we just jam it right down and start to do what? Damage our gums. It's very important that we hug the tool. That way we don't damage the. That's basically it. Everybody understand? Alright, next. Another thing is that we should visit our dentist every 6 months. Let me see the hands of all those who visit their dentist every 6 months. A question? Alright, let's pause for a moment. That's a very valid question. Everybody hear the question? Ask the question one more time, please.
I was asking what of
Everybody hear the question now? Yes and no. You guys know what a water floss is? Daniel, you want research it on YouTube or on Google. So a water floss is a machine. You guys listening? A water floss is a machine that ejects or spray water in between the teeth forcefully to remove the buildup. Alright? To answer your question, what's your name? Antoine. Yes, it is as effective, but you need to be mindful about it. Why? Yes, it will blow out the bacteria or the buildup there. However, if you're not careful, there are some water floss that are high pressure and can also do what? Damage the gum. So just like we said with the thread floss, be mindful. I'll say be mindful also with the water floss. But an important indication or use of the water floss is for those who have braces or any other cosmetic or orthodontic appliance in their mouth. So for example, when you have braces in your mouth, you recognize that the floss can go in between.
Yes.
So the water floss do what?
Fill reservoir with
The water floss will clean in between the teeth. So it has its purposes and it is advised to be used, but be mindful in how we use it. Alright? That answer the question? And everybody see how a water floss look like? Or you want to watch the video?
brushing alone is not enough. If you just brush, food and debris get left behind. The Waterpik Water Flosser is the easy and most effective way to clean between teeth. To get started, follow these simple steps. Fill reservoir with warm water and place firmly on the base. Select a tip that's right for you. Click firmly into a handle. If this is your first use, you'll need to prime the pump. Number 1, set the pressure control to high. Number 2, point the tip into the sink. Number 3, turn on until water flows. Number 4, turn unit off. Now let's get on to water flossing. Start with the lowest pressure setting. Lean over the sink and place the tip in your mouth. Turn unit and water on. Partially close lips to prevent splashing and let water flow from your mouth into the sink. Aim the tip at the gum line. For best results, start with your back teeth. Move along gum line, pausing briefly between teeth. Floss front and backside of teeth for 1 minute a day. The Waterpik Water Flosser removes up to 99.9% of plaque from treated areas and is up to 50% more effective than straight floss. You can have healthier gums and brighter teeth with the Waterpik Water Flosser.
And of course, that's an advertisement to advertise their product. Alright? And everybody will overemphasize their product. Alright? But as I said before, be mindful with it. Now, here's another question. Why should we visit our dentist every 6 months? What should we do?
You can see that you have like a bacteria or a cavity that you did not know about, and you could fix it before it gets worse.
So you can get early treatment. That's one point. Similar point. You can detect early situations and fix them. What else should we do when we go to the dentist every 6 months? Check on the teeth and do what? Clean. Or what should we do? Clean our teeth every 6 months. We should do what? Every 6 months, what should we do? Clean our teeth. Let me see all those who get a clean in the past 6 months. From the dentist. Last week. Misha. Right? It's very important that we do cleaning every 6 months. Why? When we brush our teeth and when we brush our own teeth, we can't see everything. And this is why it's important to go to the dentist, because the dentist is going to use the correct instruments to remove all the plaque and calculus buildup. Now, many times we're eating and we recognize the food goes to the side of our cheek, and we start using the finger, we kind of take it out, right? And we find sometimes food eat up somewhere else, and we try to take it out, but we can't see. We need to go to the dentist to get that clean. And if we don't get that clean every 6 months, what's going to happen? You develop gingivitis, gum disease, the tooth itself, the plaque build up, and when the plaque build up, what we have? Demineralization. And then we have demineralization, what happens? Cavities. Right? But if we are brushing our teeth twice every day, changing our toothbrush, rinsing out our mouth, going to the dentist every 6 months, if we are flossing, then where plaque go? Where demineralization go? If we do the right thing and we are consistent with it, then we won't have cavity. Then we won't have loss of teeth. And then we won't have what? Mashed mouth. That's all. Right? So it's very important that we be consistent. Next slide. The final thing about oral hygiene is what we need to do what? Eat healthy. What we need to do? So what are some foods that we should avoid? A lot of the acidic drinks, junk food, sweet. If we are going to be drinking soda, it is wise that we use straw, because when we drink the soda from straw, what it does? Right, it doesn't go on your teeth. What else? What else should we avoid? Pastries, right? But here's another thing. Did we know that starchy foods can cause cavities? Like our yam, our pork, our dashi, our rice. Not just stain, it can cause cavities. This is why it's important that we brush our teeth. Not because we're not eating the sweets, we think so we can't get cavities. But other food can cause the cavities. And it's not necessarily food that causes the cavities. It's the breakdown of this food in our mouth that causes the cavities. That makes sense? Everybody understand? So what are some food that we should eat? Apples, bananas, strawberries, peaches, melon, grapes, peaches. You say something, Kenji? No? Star fruit. All right, but here's a question. You want to say something, Kenji? Pineapple. But here's a thought. Here's a thought. We should take part in dairy products like milk, or for those who are lactose intolerant, we can take part in foods that have a particular ingredient. We spoke about fluoride before, but what is the name of this ingredient or mineral in our food that helps to strengthen our teeth? Iron, no. Calcium. Thank you very much. What is it called? Calcium. Calcium is very important. So we need calcium to strengthen our. Nice. Next. All right. Let's talk about some results of bad oral health. We are coming to an end. Let's pay attention. If we don't take care of our teeth, if we don't follow everything that we spoke about, what are we going to have? Cavities. What else? What else? What else? And what else? Right. I think there's a picture coming up that everybody's not going to like. Right? So that what you see there is actually cancer in the mouth. Right? We can develop cancer in our mouth. Right? Now, it is said that, you guys listening? It is said that our mouth is a mirror or a true representation of our overall health. Right? Which means, as dental professionals, we can look in the mouth and we can diagnose HIV. We can diagnose diabetes. We can diagnose cancer. Just by looking in the mouth, we can diagnose certain illnesses that we will recommend to your doctor. Hey, take a look at this because there may be something developing. What we need to appreciate is that our mouth, like other ears in our body, is like a gateway into the rest of our health. And if we don't take care of our mouth, then we're affecting our overall health. That makes sense? That makes sense? Right. So if we smell somebody with bad breath, it's not just the fact that they're not taking care of their teeth. It may be something else happening. You understand what I mean? Many of us who have sinus issues, and we see the hands of all who have sinus issues, and you wonder why your breath even smell like that every time when you still brush your teeth every day. These are things to take into consideration. This is why you need to go to your dentist. To check up how often? How often you should go to the dentist? How many times a year that is?
2.
Thank you very much. Next slide. Oh, sorry, is that a question? What costs money? Does it cost to go to the dentist? Does it cost to go to the dentist?
Yes.
I mean, listen.
Well, it can cost less if you have a health card.
Thank you very much, sir. It may cost you less if you have a health card, but not everyone has a health card. But let's take it. You want to say something? Thank you very much. You see why it's good to know things around you? The government afford for everyone to get dental and medical care in our clinics island-wide. So if you don't have the money to go to a private practice, you can go to a government clinic. I know it's not the easiest thing. I know sometimes it's a whole day kind of vibe, but it's very important that we know that this care or the care is out there that we can take benefits of.
Is it not more efficient to go to a private dentist?
That's a very valid question, and I think me being in the private practice is a little bit biased in my answering, but I won't want to compare. I would like to say to each their own. Whatever it is that you see you can afford or based on availability, you take the opportunity to go. Also, there are other offices, like the offices that I'm at now, are offering discount for back to school. We also have a lot of health fairs. If I'm not mistaken, there was a health fair that kept here, Jeffrey, about 2 or 3 months ago. There was a health fair here, right? Over the weekend, I was at about 2 health fairs. So there are a lot of health fairs happening. It is a matter of being aware, being knowledgeable, and take use of these opportunities. That makes sense? That answer the question? All right. Bad oral habits. Let's talk about this real quick. I know everybody guilty. Nobody will guilty. Nobody go online. Nobody go online. We know all of it guilty. Number 1 is what? Nail biting. Let me see the hands of all those who nail bite. Yes, yes, sir. Why should we stop nail biting? Bacteria in the nails. What else? Can cause bad breath. Leaning on the fence with that one. I didn't hear what you said. It can wear down your teeth. Thank you very much. We're basically grinding our teeth like that. I won't say it's not designed, but here's what I will do and expound on this point. So he said that The teeth are not designed to bite on something that's hard, but it is. As a matter of fact, our enamel, are we listening? Our enamel is the hardest substance in our body, even harder than bone. That's why we can chew bones up. But the thing is that the surrounding tissues, our muscles, when we constantly bite and bite and bite, we can cause pain in the neighboring joints and muscles of our face. I don't know if anybody has issues or pain when opening or closing. I used to have issues when playing the saxophone, and I don't play the saxophone for hours. I feel pain. All of these things are things to take note of and visit your dentist. Alright? Question? Right, so all the dirt, all the bacteria in our nails is going to go right in our mouth when we keep biting. There's something else, something in the reverse, the final thing I'm looking for. Sure, go ahead. If you square, I can't answer that question. I can't answer that. The question is that why, when she put her tongue, when he, listen guys, listen Linda, when he, sorry about that, what's your name? What again? Arshaben? Arshaben asks why when he put his tongue at the back of his throat, why when he put his tongue behind his teeth, he feels squares. I would say you need to go to the dentist so we can properly examine. Everyone has it? Then I think I need to understand what you're talking about and what it is that you're seeing. So once I can see that, then I can tell you. Okay? So after, no, I can't do that. So afterwards, when we're finished, you can show it to me and I will tell you. Okay? Alright?
I should be.
That's on the tongue twister.
Actually, he does this.
That's that.
Is it that he's feeling like a hard something in the bum line or something?
Again, I think the wise thing is when we're finished, I can take a look or we invite him to the office and then we can properly answer. Because it may be something that everyone else can't feel or relate to. Alright? Now, back on the point of nail biting. We said everything about as it relates to how it affects our teeth. But how does it affect our nails when we nail bite? What happened? We can damage the areas of our the cuticles of our fingers. And we can have an infection developing inside there. You understand? And that's how infection and things develop and move from one area of our body to the next. It can cause ingrown nails. So we need to stop the nail biting. So like a plan? Here's another thing though with nail biting. You guys listening? Sometimes it's easier said than done. Sometimes we need to go down to the root of the problem. There are many of us who are anxious, many of us who are stressed, many of us who have anxiety, or just have a bad habit of biting. It's easier said than done just to stop nail biting. How about let's go to the root of the problem? Let us get help if we need to get help. Let us talk to a friend. Let us talk to Jeffrey. Let us talk to let us talk to our parents so that we can alleviate stress. Let's talk to the government. Let's talk to Jesus Christ. Go ahead, Kenji. Go again.
That's that. I want to see.
Right? Okay, so the point is that what happens when you keep biting your gums or the cheek, right? When you're nervous or stressed, sometimes, or not sometimes, we just sometimes just do it and we organize that we're doing it. But that can cause damage over time to the gums, right? We really need to seek help. That's number one. Alright? To prevent any further damage, it can cause infection, it can cause ulcers and sores on that gum line and become very painful. I don't know if any of us ever brush our teeth and it miss and cut our gum and for days we have pain. You understand? But we have to stop those habits. Alright? You have a question before we move on? So she wants to share an experience. Can you stand for me, please? What's your name? Parisa? Parisa. Alright, go ahead, Parisa.
I bit my cheek when I was getting my foot like 2 hours or so before, and then
2 days after because it's painful. We actually call that a traumatic ulcer. So it's very painful. Yes, sir.
about the infection nearby, it will expose the skin and then the bacteria that will inside the finger sometimes lead to
Amputated. So you basically can lose your finger. You can lose your you can lose your finger or lose your fingernail. I don't know if anybody ever lose their fingernail yet. For all those who used to play football or sports and no finger and no toenail we lose. You understand? But we can lose our nail because of the infection developing there. The other thing is thumb and tongue sucking. Hands up all those who suck them thumb. Them thumb and them tongue. I used to do it. What happens when we suck our tongue or suck our thumb? Push out our teeth. Right. The teeth get buff. What else? You go what? You don't get what? An outward bite. What else? We said this earlier with the nail biting. What else? Your finger develop an odor. In other words, your finger thinks. And what else other things? Your mouth. Right? And what else did we say? Bacteria. If we're sucking up all the bacteria. I remember having a patient last week. Her mother said that the child does not put that finger anywhere. She just has the finger cock off because she knows that's the finger that she put in her mouth and she don't use it to anything. You understand? So all that bacteria is going right into our mouth. And we wonder why we get sickness. We wonder why our throat bothers us. We wonder why we develop certain illnesses throughout our body. It's because we are ingesting all of that. Because we're sucking at the thumb, or the finger, or our tongue. Right? Next thing is what? Brushing too hard. Sorry, go ahead. Very valid point. What are some ways you can stop that habit? Well, I can speak from my personal experience. And my personal experience is that we just wake up one morning and decide to make a stop. But nonetheless, you can. No, we're amputated. You can go to the dentist and we can create what we call mouth guards or tongue guards or different appliances that can go in the mouth to prevent you from sucking the tongue. No, there are some Jamaican remedies that I won't say they are dental proven, but they did try that with me, and we are Jamaicans. Then you will sing the Bible, then they will try all kind of animal feces. Let's try it in a diplomatic way, right? They will try all kind of different things to get them to stop sucking the teeth. You want to suck me, Misha? Alcohol, Vicks. You understand? Hold on, listen guys, listen. It can be an addiction. It can. It's a form of addiction because many times we use it for comfort. It can be, again, stress or anxiety, right? Another thing to take into consideration is that it develops from even a baby stage. So when we're on the soda and our parents, they take out the finger out of our mouth, it's a matter that we are going through our teething stage. What do we mean by teething? Your teeth are erupting. So you find a way to compensate and ease the discomfort that you're feeling. And then it becomes a habit. Over time, you can't get rid of it. When I stopped sucking my finger, I stopped sucking when I was about in first form. First form, I stopped sucking my finger. It's my record. Yeah? Sorry, be said congrats. You understand?
I stopped in one day because I just remembered that on my phone.
Didn't taste good. Right. He stopped in one day. And I'm proud of him. Alright? What he said? Anyway, anybody else have any question as it relates to that?
I didn't know teeth have
Teeth have what?
teeth have
That's an animation. What did we say about brushing too hard? What did you say about brushing too hard?
It will destroy the gums.
Destroy the enemy and the gums and they will have what? Bleeding and sensitivity. Thank you. Grinding and clenching. Grinding and clenching. Any of us grind and clench our teeth? Right? And that could be stress. It could be something we call bruxism in our sleep. What happens when we grind our teeth? We wear down our teeth. What do? We wear down our teeth. Right. I like his answer. Everybody heard his answer? So listen again. Are we listening? Number one, we can grind down our teeth. Number two, we can cause small fractures. We call them hairline fractures. Take a look at the female's hair. The strand of one hair is so fine at times you can't see. We call it a hairline fracture. And that can happen within our teeth. Another thing that we can develop when we are grinding is sensitivity. And finally, when we grind our teeth, we damage also the surrounding what? Joints and muscles and tissues.
Alright, how do you stop yourself from clenching or grinding?
Very valid question. And that is again dependent. Listen. We're listening. That is dependent on what is causing us to do it in the first place. So when we can diagnose why we're doing it, then we can treat it accordingly. For some persons, if they're grinding their sleep, we need to ensure that we're giving them a mouth guard in their sleep. For those who are doing sports, we need to give them an appropriate thing for sports. For those of us who are horn players, or those who are using mouthpieces for our instrument, we have now the mouth pads for our instrument. Thanks to Richard Sack for helping me over there with too, right? Which we need some more. Because imagine biting down on a metal and we are grinding our teeth on that metal. It damages our teeth over time. So we need to have our protective mouth guard on our instrument, right? Another thing could be the fact that whenever we are stressed, for those who work in heavy lifting areas, all of those who in the future want to be a construction worker or do any heavy lifting, once you're doing heavy lifting, you're grinding your teeth. We need to protect our teeth accordingly. If you would like the satisfaction of grinding your teeth together, just like sucking your thumb, we need to find a way to stop that satisfaction and find a different satisfaction. Because you're only doing yourself injustice. Understand? No, what she's saying is not really just a dental issue. This is more a mental thing. Now, we spoke about this earlier, my friend, Parisa. We spoke about practice, and practice becomes perfect. So if we discipline ourselves to change a habit at least for a week, and then we try for another week, and 3 weeks, if I'm not mistaken, science proved that 3 weeks, about 3 weeks, we can actually change the habit or develop a habit. Right? That means they need to be a little bit more disciplined, my friend. Right? Oh, man. Man, a reason with it. You must say, yo, anyway, turn Mac a joke, yo. I know the truth about it, but here what happens. Again, Substituting one bad habit with another bad habit, is that good? Two wrongs don't make a right, right? So what we need to find out, what's your name again? What's your name? Gavin? Gavin. What we need to know, do Gavin, is now find a healthy habit to replace the bad habit. That makes sense? Cool? Alright, the next one that we have is chewing ice. Everybody put up their hand, because we know everybody chew the ice. Without a doubt. No? 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 I remember one particular girl said to me that, sir, what is the point of life if I can't get to chew ice? Because many times we feel like when we go KFC or Burger King and we done the juice and the ice left back, we need the full worth of the money, so we need to chew the ice. That's all. That's something you used to think too. Your mother addicted to ice. NJ? Chew up ice like snap, right? You will eat ice for lunch if you don't want anything. No. Listen to me now, people. This is why it is not important, why it's not good to chew ice. Number one, what does ice cause to our teeth? Sensitivity. Thank you very much, my pediatrician. The pediatrician said that it will cause sensitivity. And another thing that was said earlier, you know, so the young shall lead them because the two young ones will give some good answers. Not saying the older ones are, but I like the answers coming from the younger ones. And then my friend over here said this earlier, that we can have fractures in our teeth. So chewing on the ice can cause what? Fracture in our teeth and sensitivity. And let me tell you this. Many times we think that tooth pain will laugh about it and we think it's funny. But I tell you, toothache can make a grown man cry. Don't take it for granted. You understand? There are other things to take note of for our young women who go through puberty. I mean, as males, we recognize a lot of males inside here. We can never appreciate and understand what females go through. But it's very important that you are educated. Females go through many different hormonal changes monthly at different stages of their life through puberty, we're listening, and also through pregnancy, also through menopause. And what happens is that you will find different habits. One of the main or the common one, KJ, to your female friends who like to chew ice, is that they will chew ice for comfort. But this doesn't mean that you're going to continue. It means that we need to replace the bad habit with a good habit. Thank you very much. Cool? Next.
Everybody stand. Sit. Stand. Sit. Stand. Sit. Hello, let's stand up. Everybody stand. Can't sleep.
Coming to an end, man. We're in the
Class, hold on.
the finish now.
Alright, never see.
And then the last thing is that we are using our teeth as tools. Let me say hands of all those who use them teeth as tools. To open bottles, to pull bags, to do all kind of different things. That is not a function of our teeth. Yes, it is. The question is, chewing the butter card and the straw and the back juice bag. We can go through the long list of things we do as children. We should cut all that out. Questions or suggestions?
There's one book that's someone has to serve the water. The bottle is like really small.
No, you don't have to. You know, don't tell yourself you have to. Find help. Find somebody who is stronger, or do some push-up, or use a rag where you don't use your teeth. God did not design our teeth to pull bottles.
Sir, always told us your teeth is strong enough to chew the bones. So most of them, you learn how to bite the bones just to get extra meat.
That in itself, I won't discredit, because when you cook a meal and when you cook, it's made with bone and they are cooked properly, the bone itself will become tenderized, right? But biting down on bone is proven that it can cause damage to your teeth and crack as well. Especially those curry gravy and mutton gravy with that small piece of bone that is hidden. That when you finally bite down on it, you get a big fracture. Starting from this side to that side. Go again. What will happen if you keep chewing cords? You can damage your teeth. You can damage it. It's just like grinding, right? Go ahead. You can get tongue cancer. That is a possibility because listen guys, he's asking if chewing on materials can cause cancer. There are cancerous materials out there. Plastics and so forth. You can if you're not careful. Remember, these things weren't made to be edible, so why do we want to eat them? Because what? No. Misha, you want to do something? Hold on. On this side, anybody else you want to say something? You bit a candy and broke your tooth? 2 of them. He bit a candy and broke 2 teeth. No, we're not going to be doing that. We can exude our feelings and emotions in a different way. Are we listening? Go ahead, you have a friend that?
I have a friend that wrote the entirety of their between parts every single day. And like the end of first cup, the start of second form, he had braces.
You understand? You have to stop that habit, right? No, I'm going to end here. This is the last time before we go into our questions. I'm going to end here because we have to be educated as it relates to the functions of our teeth. I heard him say something about biting is to release stress. No. Our functions of our teeth are, number 1, what do we do with our mouth and our teeth? Eat. Consume. It is very important. Chewing and eating, our mouth is very important in the digestive process. Number 2, what do we do with our mouth? No. We speak. If we don't have the correct teeth in our mouth, if we have misalignment of teeth, then we won't be able to pronounce our words properly. We can have lisp tongue, right? You understand? If bubblegum can affect your teeth, it can. Mechanically and chemically. If the components of the bubblegum is sugar and it has all the components of all the bad things that we say we should not eat, what's going to happen to the teeth? Cavities, decay. And also the mechanical stickiness of it, it can cause pain to the teeth as well. It's proven like that. Alright? Back to the functions before we take any more hands. So we said eating, we said speaking. Another thing will come out to our mouth. What is important? What we use our mouth to do? Smile. What about smiling? No, we need our mouth. It helps to build our confidence. Now imagine, if we are not confident, what do we tend to do? We do what? Close our mouth. Huh? You can. That's a valid point. That's why whenever we sleep at night and our mouth is closed and we wake up in the morning, we smell that odor in our mouth. You understand what I mean? So many times we forget that our mouth is responsible for our self-esteem, for our confidence. We are young men, young women who are going through puberty now. We care about ourselves. We care about the way we look. Not true. Not true, Parisa. So that means we'll stop the tongue, right? And the finger. Right. Anybody want to share any other functions of the mouth? Thank you. For those who use wind instruments, we use our mouth to play our. We use our mouth to do what? To play our instrument. Alright, next slide. So that is it, ladies and gentlemen. We are coming to an end, and we have some lovely gifts on our left. Right? But that's all like everybody will get. It's like everybody don't. Alright, so given that everybody should make it, let us just go through the different questions. Number 1, What are the 2 sets of teeth a person have in their lifetime? Let's choose the hand. Let's use the hand. Temporary teeth and next question. Who can give me another name for temporary teeth? As a matter of fact, I want all 4 other names. Let's see. Richie Sachs, you choose one. Richie Sachs, choose somebody.
Stand.
4 of them. Let's go. All 4 of them. Milk teeth. Baby teeth. Deciduous. Anybody else want to try? No, another name for temporary teeth. 4 other names for temporary. That means I can't give up temporary. Alright, go ahead. Baby teeth, milk teeth, primary teeth, and next question. Who can name the 4 types of teeth? And more. How long should we brush our teeth? Alright, this hand went up first. 2 to 3 minutes. Wait. How often should we brush our teeth? At least 2 times a day. Thank you very much. What kind of toothpaste should we use? Aaron. Go again. Toothbrush. Toothpaste.
Stand when you're on the table.
What kind of toothpaste? Fluoride toothpaste. Thank you very much. What does the fluoride do? Follow-up question. What does the fluoride do? Make it seem stronger, but I'm looking for a specific word. It mineralizes, remineralizes your teeth. Thank you. Should your toothbrush be hard or soft? Thank you. How often should we brush? Next question. Name some healthy foods we can eat. Alright, this side. Apple, grapes, pineapple, peaches. Alright, hands down. Follow-up question to this question. What is the important ingredient in our meals that we need for our teeth? Alright, go ahead. Calcium. Nice. Next question. How often should we visit the dentist? Every 6 months, twice a year. And when we visit the dentist, what should we do? Get it clean. What should we do? Get cleaning and check up. Thank you. Give me 3 bad oral habits. As a matter of fact, I want more than 3. Give me probably 4. All right. I'll give you one. Sucking of the thumb and tongue. Grinding and clenching. Biting fingernail and nail biting. Eating ice. Anybody else? Using your teeth as tools. Anybody else want to give any other one? No? That's all I get? So like it done? Next one. Name some results of poor oral health. Alright, we're told that we should stand. So let's take an answer from this. Yeah, let's go. Bad breath, that's one. Gum disease. Mouth cancer. Pretty girl, you want to say something? It's them say answer already. 14. Tooth decay. Can cause infections. Bad breath. Demineralization of the tooth. It can cause what? Cavity. Inflammation. Big boss, you're going from there. What on? You are telling him. Also, you are telling him answer and him answer. Alright, boss, I hear you. Is that it? All right, so that is it. Put your hand together for yourself. Before we end, are there any questions? Listen, guys, hold on. Can we get some perfect silence for the questions, please, Stan?
I have this friend that you have two teeth. Two little teeth, the top and bottom, but you have teeth that are growing. The side of the teeth. So I'm just asking what kind of.
Alright, so it could be one out of two things. It could be number one. What age do we say the primary teeth come up? 6 months. And what age do they change over?
6 years.
At age 6, at 6 years old. It could be a case where the baby teeth is not coming out when the permanent tooth is pushing up. Hence, it was just, in Jamaican terms, it cuts right on the side of it. Or it could be number two, he has extra permanent teeth coming up in areas either before or behind it. Or it could be number three, there is not enough space for the alignment of the teeth. So instead of coming up side by side, they become in front or behind. Understand? I mean, in Jamaican terms, we say double row teeth or crowding or whatever, but there are different terms for it. Right? Right? And with that, we need help with our dentist, and we go to an orthodontist for treatment. Question? Alright, so the question is, where is my office located? My office is located in the future, wherever God decided to be. Because I don't have an office, my friend. However, where I am currently located is two places. One, Otrius at K Smiles Dental, which we need for work. Right? K Smiles Dental in Otrius. And recently, starting this month, I'm now in Kingston at Pure Smiles Dental. Alright? If any of you would like to get treatment done, you can ask Jeffrey, and Jeffrey reach out to me, and we can do further communication from there. All right? Any other questions? A good question. First, we're going to go back to the answer I gave to this young man here earlier. We first need to diagnose what it is out of the three options. And what we say the three options are, it could be the baby teeth and the permanent teeth. It could be an extra permanent tooth, or it could just be no space or misalignment. Depending on which one, then we make a decision. So if it is option one, where it's the baby tooth, we remove the baby tooth. If it's option two, where there's an extra permanent tooth, we may or may not remove that extra tooth. And if it's option three, where it's just a case where there's not enough space, we may extract it, or we create space for it and put it into alignment. All right? Any other question? Stand so everybody can hear. Stand. Parisa is on the floor, guys. Give Parisa your attention. Go ahead, Parisa. So she's asking which one is better, chewing on the ice or teeth grinding. But I'm going to ask somebody in the audience who would like to answer that question.
Chewing on ice.
Chewing on the ice.
Incorrect. Not to do either. Thank you very much. What's your name? What again? Aisha. Aisha. Kaisha says, and I'm saying enough. Kaisha says not to do either. And why is that, Kaisha? They are both bad habits. And Gavin, what do we say about bad habits? Find a good one to replace it for Sarah. Thank you very much. Answer the question? Okay, any other question? Not necessarily. I say when we say that good habits to use to replace them. You're all about, you find what works best for you. No. That's a bad habit. So find a good habit. Your assignment first is to find some good habits that you can use to replace your bad habit. That is sweet as well. So I can't condone that one. But he said instead of eating ice, eating marshmallows. How about you eat something else that is healthy? What works best for you? Question, Kenji. And Kenji asked if it is bad to chew bone. To some extent, yes, it is because it can cause damage to your teeth if the bone is hard. Alright? I know scientifically proven that persons are saying in the bone is where you find some of the nutrients that you need. However, you be mindful because some bones can cause chip and damage to teeth. I don't know if you ever experienced it. When I eat a curry chicken or a curry goat meal and the bone and the gravy, and you bite on the bone and the gravy. Listen, it's not one of the nicest things, right? Go ahead, Misha. The process of going through a retainer. Alright? And the price. First things first, the term retainer means it does what? It retains. So a retainer is more the after treatment or the protocol that is put in place after receiving the permanent treatment. So before you reach retainer, you need to go through your permanent correction first. So my recommendation is you visit your dentist. Your dentist will be in a communication with your orthodontist. You go through the correction of the alignment of your teeth, and then the respective retainer will be advised. There are different types of retainers, and we don't need to go all the way down that. Depending on which retainer, then we would advise the price and how it is placed in the mouth, whether it's permanent or temporary, or you have to remove it, or it stays there. We go through all that shenanigans, right? So I can't give you a set price off the top of my head, all right? Question?
On the terms of sweets, I know that sweets are bad for you, but stand up. You can get to a point where, like, say you have high blood pressure, you need some sweet in your diet, right? Would a high blood pressure person need like different types of sweets or?
As it relates to the sweet, I don't believe it is the high blood pressure that you speak of. It's more probably the diabetes, right? Those who are diabetic and will need the necessary, let's say, nutrients. There are different forms of administering the different nutrients. One most common is insulin that is needed, and it could either be via patches, can either be under the tongue, or as your doctor advice. Now, sweets is not necessarily the corrective measures, but it's something that can help in the interim time for those who need help. Let's be a little bit more specific. It's the glucose within the sweet that is important. And you have the broken form of glucose. Anybody know glucose? When you give a baby glucose, everybody know glucose, right? Sometimes we will have that in the office, but when our patients seems like they're about to faint or experience anything like that where they're diabetic, right? We would mix some glucose or put on their tongue that would help them, or smelling salt. So my advice is it's not that the sweet is what is recommended, but it can help, but you try to avoid any sugary sweets. Alright? But there are other forms, there are other methods of coping with that specific illness. You understand? Anybody else? Who? Who we pointing at? Oh!
Someone that tells me I realized that sometimes they just jump on the floor and start shooting, and then they say, we need to get like a speak for them.
You know, I won't say seizures. It could be a plethora of reasons, and I think that has to be properly diagnosed. It could be seizures. It could be other mental situations. It could be a case of them being diabetic. It could be different reasons. No matter what is their diagnosis. I like the fact that you're concerned for your coworker. My suggestion is that anytime we find ourselves with any illnesses, this is why it's very important when we're filling out our forms, even joining Food for the Poor Band Camp, or at school, or at home, that somebody around us know our illness and know how to help. We need to ensure that we have our emergency contacts. We need to ensure that we have our medications on standby, especially for those who are asthmatic and we're here playing with instruments, and those of us who are in the dust and this hot time, whatever it is that triggers our illnesses, we need to be aware of it. We need to know how to counteract it, and we need to ensure that we have emergency contacts and help around. All right? That sound like it? No questions? All right? That sound like it? And I'll encourage. I'll leave this note and encourage. All right? Don't take for granted. As I started off by saying, I'm going to end by saying, don't take for granted this opportunity that you have. If any of you guys would know how many students, how many children out there, how many parents out there that would want their students or want their children or just want an opportunity for somebody to invest in them like this, they would grab at it urgently. I'll share quickly how I got into Food for the Poor. Was just somebody know somebody from know somebody. I never know Jeffrey, but somebody know me and know our friends and say, yo, come go to the Food for the Poor band camp. Like what over the weekend. I remember 1 year after, Jeffrey said to me that, you know what, MJ, I'm going to make you play saxophone. I started out playing the drum. I tell Jeffrey, said, I can't do that. There's too much button left on that. We don't know that, like, all them little button things that never work out for me. Because we just know drums. Drums is just my thing. You understand what I mean? But thanks to God and thanks to Jeffrey Brown for believing and investing years upon years upon years, I can safely say that the saxophone or the talent of the saxophone has changed my life. You see me here as a dentist, I'll say this much. The Bible says your giftings and your talents will make room for you. For those who don't believe in God, let me explain. What the Lord will give you through your talents and your giftings, blessings will follow it. And I can say to you, throughout dental school, it's not because I may be the best student, but I even had a lecturer up to this day, I say this every time. She walked up to me and she never know my name. And she said, Mallory, when you come pay one event for me, I'm not paying no money. But anything I want at dental school, they give you. And up to this day, anytime she takes up the phone to call, she didn't know my name. And when she called, I'm coming. Because what? In return, they poured into me through dental school. I never have the money. Dental school expensive. We're not talking about. How many of you guys want to be doctors? Many of you guys want to be pediatricians. Many of you guys want to be teachers. Many of you guys want to be so many things we aspire in life. Don't despise this beginning. Don't take it for granted. Are we listening? Are we listening? Don't take it for granted. Many persons have come through this camp and left the same way. But only a few take it and change their life. If you ever take a stop to learn about the testimony of many of your lecturers today, so Richie Sachs has a testimony here. If you ever know Jeffrey beginning, many times we just see Jeffrey and laugh and run joke. If we know many of the beginning of many of the youths around us, who took us out, some of us out of gang violence, took some of us out of the garrison, and now safely some people can travel the world and play for the name brand artists them out there in life. But what we're getting at is the principle behind it. Don't take for granted. Be good stewards over what the Lord has given unto you. This opportunity. It could be the flute, it could be the recorder, it could be the clarinet, it could be the saxophone, it could be the trumpet. And today I am grateful. I'm grateful for this opportunity because what? It has afforded me JCDC titles, national titles. It has afforded me through dental school. It has afforded me to be in ministry. But don't take it for granted, people of God. We are all children of God. Don't be mistaken. And if you have not given your life unto God, don't take it for granted to give your life to God. Because what He's given unto you is a great talent. Don't take it for granted. You understand? You understand? And one thing is that today, with good oral health, we have to implement it in our lives because as musicians, we carry ourselves with dignity, with a level of class, and with a level of honor and respect. Alright? Those are my few words.
Everybody stand.
straight. That's some long time. Alright, have a seat. MJ. Come, Miss Young Miss. Yeah, we talk loud enough so everybody can.
On behalf of the Food for the Poor Bantam.
Hold on this. Let me get it.
On behalf of the
Wait on this. You know, this one could kill up the camera. I don't want to put.
On behalf of the Food for the Poor Bantam, we want to say thank you, Dr. Marlon Jr. Williams, for teaching us about oral health today. Dr. Williams, thank you for your time and for showing us how to take care of our teeth and our health. We really appreciate you sharing with us your knowledge. Let's give Dr. Junior Williams, MJ, a big round of applause.
I was hoping that she'd have shared in the vote of thanks that she's going to, change the habit of sucking her tongue and what else? And chewing ice. It sounds like a plan. To try. Please try. Thank you guys very much.
Yay!